Phase in the fight against COVID-19, kids can now roll up their sleeves as the rollout for the vaccinations begin today. According to the Center for Disease Control and Prevention, kids ages 5 to 11 can now get vaccinated.
That's right, Alicia. Scientists concluded clinical trials with about 3,000 kids to get ready here. This is a big step to help protect children against the deadly virus. And joining us this morning is Dr. Anita Kurian. She's the Assistant Director with San Antonio Metro Health to discuss this big move here and obviously what parents need to know. Good morning, Dr. Kurian. Thank you very much for being with us.
Good morning. Glad to be here.
Yeah, and there's obviously a lot of concern from parents, as far as like what they need to know. So what are officials saying about the safety of these vaccines and any sort of possible side effects or risks that people may need to know about?
It's understandable for parents to have questions and concerns, but please know that these vaccines have undergone and will continue to undergo the most intensive safety monitoring here in the history of our nation. So the benefits of this vaccine at this time far outweigh the risks. Similar to what was seen with the adult vaccine trials, pediatric vaccinations, COVID-19 vaccinations, they are 91% effective in preventing the disease among children in this age group, 5 to 11 years of age group. As you mentioned, the clinical trials, the side effects were pretty mild, self-limiting, similar to what we had seen with adults and similar to what we see with other vaccines that have been recommended for children. And the most common side effect that was documented in clinical trials was sore arm. So getting a child vaccinated can certainly protect them against COVID-19 as well as reduce any disruption. And this is important to in-person learning and activities that they might have missed out on, and its vaccinations will certainly stop or slow down the community spread of COVID-19 here. So I strongly encourage parents, if you still continue to have questions regarding any of the side effects or effectiveness, I encourage them to have this conversation with their pediatricians, school nurses, local pharmacists. You can certainly call us at the health department to learn more about these vaccines as well.
And one of the misconceptions would be on the dosage amount. Still, some parents believe that it's the same dosage that adults are getting, but there's a huge difference, correct?
Correct. The pediatric vaccine doses it's the 1/3 the adult dose, and these vaccines would be given in 2 doses, 3 weeks apart. So it is 1/3 the adult dose, and I want to stress here the lower dose was chosen to minimize the side effect and still produce the strong immunity. It is 91% effective against preventing COVID-19 in the 5 to 11 year age group.
Okay, Dr. Kurian, so obviously it is flu season. We know that a lot of people are getting flu shots around our area. How do those kind of intertwine? Can kids get the COVID-19 vaccines and others like the flu vaccine at the same time, or what's your advice when it comes to those questions?
Absolutely. Kids can get a flu vaccine along with the COVID vaccine. They can be co-administered at the same time at the same visit. We just have to make sure it's a different injection site. No problems there.
And the plans, we know right now parents, there's still some hesitancy for some, but the majority are eager to get their kids vaccinated. So the question here is, what are the plans for the rollout for Metro Health in Bexar County when it comes to children's vaccine for COVID-19?
Sure. So this is not just in Bexar County, but nationwide. Pediatricians' offices will be the essential site for distribution of this vaccine for young children. And this is primarily because this gives parents or caretakers or guardians an opportunity to ask questions of their child's pediatrician, right? And it also gives the pediatricians to help the children catch up with some of the vaccines that they might have missed because of the pandemic and the stay-at-home orders or office closures last year. So pediatricians' offices will be the essential site for distribution. But in addition to these doctors' offices, it'll also be administered at Alamodome, our MassVax site, and all of the pop-up sites that Metro Health hosts. We plan to roll out on November 10th. That's when the administration will begin at the Alamodome as well as the pop-up sites. And in addition to all these sites that I mentioned, these vaccines will also be widely available, easily accessible at community health centers, at your retail pharmacies, and any of your school-based clinics as well.
Dr. Kurian, real quick before we let you go, I wanted to ask a quick follow-up on the availability of that, because obviously when they initially rolled out the first set of vaccines, there was, people setting up appointments, there were delays, and people, a little bit of frustration for people to get appointments there. So what's your assessment on the availability right now of the COVID-19 vaccine for children?
I can tell you all of the Dare County providers, COVID-19 registered providers have already pre-ordered. I can tell you Metro Health had pre-ordered the pediatric vaccines. We've already received our shipment. I failed to mention this. There are no appointments needed at the Alamo Dome or any of our pop-up sites.
Okay, well, thank you very much, Dr. Kurian with San Antonio Metro Health, for joining us this morning on KSAT News. Now we know that you guys are busy and obviously appreciate the great work that you guys are doing there. Thank you very much. Have a great Wednesday.
Thank you. Thanks for having me.